I thank the ranking member, and I will say that I continue to look forward to working with Dr. Ruiz through this process over the next year and a half, as we have worked well together in the past, and I think we will continue to do our best to possibly have differences of opinions, which doctors sometimes do, and move forward with something that we can present to the American people as a better pathway for the next pandemic. You know, we're advocating for a multi-pronged strategy to defeat COVID or the next pandemic. A majority of Americans have had COVID and have had infection-acquired immunity. We can learn a lot from that, and we should try to. I don't believe that herd immunity was ever the Trump White House's strategy. I know people talked about it. I don't think that was ever the strategy. Protecting the most vulnerable, we saw emergency use authorization for the vaccine, and it was there for the elderly and those with comorbidities. And that was always a priority. And reality suggested that this contagious disease would continue to spread throughout the nation. Understanding infection-acquired immunity and protections it offers is essential, in my opinion, in order to resume normal life in America and end things like lockdowns. It needs to be considered. And false statements, no matter where they were coming from, especially if they're coming from a leadership position, is wrong. And we can look at studies, and we can look at comparing Sweden and Michigan. You know, Michigan had severe lockdowns and mandates. Sweden did not. Sweden had half the deaths. What's up with that, right? Why can't we look at that? So, you know, and, you know, as doctors, you can, if you're honest with yourself, as doctors, researchers, you can look at a study and say, this is a flawed study, or this is a very good study. This is a very good study without any type of bias whatsoever. We know how to do that, and we need to do that and not pretend. You know, I'm curious because I haven't ever seen anything on the initial studies, and I was very involved. We were involved with this Doctors Caucus, looking at what was taking place with Operation Warp Speed and understanding the technology, but also how the studies were being conducted. Normally, before FDA approval, you have 8,000 to 10,000 people in a study. You have 30,000 to 40,000 people, and I applaud those brave Americans that got in these studies that helped us produce a vaccine. The one thing I'm curious about is those that got the placebo and got COVID, did we look at their immunity from it? Did we make that part of our study? As far as I know, we did not. We missed that. We should have done that. That should have been part of what we're doing. Lesson for the future, in my opinion. You know, we have two or three doctors on this very committee that have actually been treating patients during COVID. And, you know, I can tell you that they feel, and they said today, that, you know, infection-acquired immunity was ignored. And when they spoke about it, they were censored. These are facts that are coming out. We got to address this and quit playing politics with it and say that was a wrong thing for any government to do on behalf of the health of the American people. Look, I got vaccinated. I also was out in military uniform with the National Guard, testing people, driving up testing. I was out giving shots with the National Guard, and when my local hospital said, can you come out? Or can you come out to the fairgrounds and vaccinate people as they're coming through to be part of this mission? So when the implication is that, you know, people on one side or the other are saying, oh, it's natural immunity only, that's not true. And it doesn't help this committee when we have comments like that coming from this committee. Let's be serious about what people were actually doing and saying and what their concerns are. And by the way, an opinion is far different from misinformation. And if we're not allowed to have opinions in the medical community anymore, then we are doomed. We are absolutely doomed going forward. More times than one, I'd say to a patient, here's what I believe, and if I see some hesitancy, I say, I would like you to get another opinion. And I think that's a wise thing to do. So when we have opinions, it's not necessarily misinformation. But the fact of the matter is, false statements were made by many. Whether they intended them to be false or they knew they were false, I don't know. but they were false statements that were being made. And some of these people served on both administrations that were doing this. You know, I don't think it helped with that. That does dissipate trust in our public health system. As I said earlier, I had recommended under the Trump administration, let America hear from the doctors treating COVID patients every day. Not someone sitting in a lab, not someone that's not bedside with anybody. Let them tell us what's actually going on. And I think that is a lesson learned that we have to move forward. Now, I heard Ms. Ross say she gave credit to the Trump administration for creating a vaccine, but I don't think it helps when a candidate for office says, well, if it's made during the Trump administration, I'm not going to take it. That didn't help build public confidence in what was going on. And, you know, when we talk about say something safe, the honest discussion you have with your patient is, we think this helps, and here's why. But also honest is, I don't know what I'll say 5 years from now or 10 years from now. And here are some of the adverse events that we are seeing. And you have a discussion with your patient and you decide what's best for you. Look, many people got COVID. They got infection-acquired immunity. It's not necessarily that they didn't want to get the vaccine. It's because it wasn't available to them. And there's a lot of information we could have gained from those people that got COVID and how their body responded to it. You know, some didn't even know they got COVID. Some people got tested or checked for antibodies and found out, oh, I must have had it. I don't know when. This is all important information and data. And it's very important. And you know what? You're not supposed to hear from Dr. Facebook or Dr. Social Media. You're supposed to talk to you Dr. Tan, you Dr. McCary, you Dr. That's who people need to go talk to. And we have to supply doctors with accurate data without flawed studies. That's the important thing. That's one of the takeaways that we need to come away with from this committee. One thing I never heard about, and I've never heard anyone discuss or studying, the possibility of hyperimmunity. You've had COVID, you've had the vaccine, you get the booster. What are the effects of that? Those are fair questions. Hyperimmunity is real. So I hope that we can continue to go down this path and have good conversations with experts and amongst ourselves, to where we can really have some good results and good recommendations to make for the future. With that, and without objection, all members will have 5 legislative days within which to submit materials and to submit additional written questions for the witnesses, which will be forwarded to the witnesses for their response. If there's no further business, without objection, the Select Subcommittee stands adjourned.